better approach to begin hearings focused on the problems in the ACA, and let's try to get bipartisan support.
The door to bipartisanship is open right now, not with repeal, but with an effort to improve the existing system.
My guess is that we're now headed toward normal committee activity that will take 60 votes on the floor.
We're going to be here in August working on bipartisan efforts, so stay tuned. We may have more news for you later on that.
Some senators yesterday calling for a return to a bipartisan approach to health care. Democratic Senator Joe Manchin of West Virginia announced he was organizing a bipartisan meeting of former governors now serving in the Senate. There are 9 in all, 3 on the Republican side and 6 on the Democratic caucus. South Dakota Republican Mike Rounds said he would be attending the meeting last night. Another of those former governors, Senator Lamar Alexander of Tennessee, announced that he will convene hearings of the Senate Health Committee in search of ways to stabilize the individual insurance market, a sign that the process is moving to regular order. And a bipartisan group of 11 current governors, 5 Republicans, 5 Democrats, and 1 independent, signed onto a statement rejecting efforts to end the law without a simultaneous replacement plan. And joining us now, one of those 11 governors, Republican Governor John Kasich of Ohio. It's very good to have you on the show today. Looking at what you've written in the New York Times, and quite frankly, listening to you on the campaign trail and in other interviews, it's very clear what drives you when you talk about health care. What is your best guess on what has driven this president through the process so far?
Look, I don't think he's ideological on this. I think that, he has political people that try to probably tell him, you need to do this or that. But I don't think he cares really what the solution is. I don't think he's embedded in some ideological program here. The more he's ideological, I think the worse he does, because healthcare is not something that should be driven. The first and foremost thing on healthcare is people need to have it. They need to be healthy. They don't need to go bankrupt if they get sick. And we know that if people are healthy, they're more likely to work than if they are unhealthy. And so my sense is that at the end, he'll sign something that will stabilize the markets, make sure that we can then head to a direction of where we can deal with the problems of rising health care, which is really related to one simple thing. There's a number of things, but one simple thing. We practice quantity and not quality. If we practice quality and paid for quality, we'd begin to rein in these driving health care costs, along with looking at all the other elements that contribute, for example, the rising costs of pharmaceuticals.
John, what would the Medicaid cuts do to the state of Ohio and to the states of the other governors, Republican and Democrat alike, that you've spoken with over the past week?
Yeah, well, Joe, you can't cut almost $800 billion out of Medicaid and say it won't matter. But Joe, I know that you would line up with me. I believe that there could be an effort, a bipartisan effort. I've talked to some governors, I've talked to some senators about the idea that we look at Medicaid, we look at Medicare, and we look at Social Security, and we begin to create reforms to get these entitlements. Because look, Joe, 80% of our debt is now 80% of GDP. As the debt rises, the opportunities, economic opportunities, begin to diminish. So I think there are ways to reform these entitlements that the American people would agree to, but you have to do it with Democrats. You can't just slam this stuff through and, well, you wouldn't get it through. So there's interest in this.
Yeah. Well, John, also, and I know you've been talking about this for decades. I've now been talking about it for decades. We have to reform the entitlements in the United States. It is going to bankrupt this country, but, I mean, what message does it send to Americans that the only entitlement system that we actually look at are for the poorest and the truly disadvantaged among us? Don't we have to, like you said, if we're going to look at Medicaid reform and cuts, we're going to also have to look at Medicare and Social Security at the same time?
Well, and I think, Joe, look, we were able to reduce the growth of Medicaid in Ohio from 9% to 3%. And we didn't basically do it by cutting. We reformed. We let mom and dad stay in their own home rather than being pushed in a more expensive nursing home if they were able to stay in their own home. We drove more competition among the Medicaid providers. Look, when you think about Social Security, for example, the default option could be something along the lines of managed care rather than fee-for-service, which is more expensive. On Social Security, you start the baby boomers at a slightly lower level, and you begin to index for wages rather than wages and prices. And that, that's not like some unbelievable hard thing. And this is something that I think the people would, if we can explain it to them, that as the debt in America rises as a higher and higher percentage of our gross domestic product, in other words, as the debt is gobbling up more and more of our economy, then you don't get economic growth. People want to grow. They want their kids to have jobs. This is not that complicated, but it's complicated by politics inside the parties and between the parties.
Governor, it's Sam Stein here. When Mitch McConnell was trying to put together the second iteration of his health care bill, he put out a package of about $45 billion in opioid recovery, relief, and research funding. That was designed to woo recalcitrant Republicans to the bill. I'm wondering, now that that bill is likely shelved, do you think he should spend that $45 billion anyway?
Oh, I think you need to have a comprehensive program. And look, I mean, right now we spend almost $1 billion a year fighting opiates, and that's why I fought so hard for Medicaid expansion. And this is a complicated conversation, but the fact is I don't want Medicaid expansion just to be yanked away. It can be, we can deal with that in a reform method a little bit farther down the road as long as we give governors flexibility. But no, I don't think you just ought to start throwing more money. With the program that's in place now, we feel we're in a position where we can manage it.
Governor, more broadly than health care, if you were writing a history book about the Trump administration, what would you say would be kind of the first couple paragraphs of the first 6 months?
Well, I don't write the kind of bestsellers that you write, Halperin, so I don't know. I think, look, they're trying. I believe that Donald Trump does best when he goes to his populist instincts rather than an ideological approach. That, to me, is what I think makes the most amount of sense. And let me say one other thing about this health care debate. All this stuff is like Republicans lose. You know what? Isn't it a great thing that Republicans looked over the cliff and saw that there were a lot of people that were going to be hurt, and they pulled back and said, let's do this in a more reasonable, rational way, because no one in America doesn't think those exchanges need to be fixed. You know, instead of all this, he won, she lost, this, it's all nonsense. Knock it off. Get this country on the right track before we end up hurting many, many people in this country because we can't fix anything in Washington.
Hey, Governor, let's swing back to your populist instincts that you just mentioned, that you just referenced. You were talking about the pharmaceutical companies a couple of minutes ago. In 2008 and 2009, the economy collapses. Congress gets to work. They pass the Dodd-Frank bill. They crack down on the big banks, and everybody is sort of relatively happy. The pharmaceutical companies and the insurance conglomerates in this country rule more people's lives equally, I think, as much as the big banks. How come nothing is ever done to make sure that we don't have to pay $600 for a pill and $8,000 for an insurance policy?
Well, I think they're powerful, number one. Number two, as we all know, that we want the development of pharmaceuticals. We want the research and development, but there was a disturbing article in the New York Times the other day that said that pharmaceutical companies are spending more money on stock buybacks than they are on R&D, at least some of the companies. And look, that's what we're seeing in the country. More and more companies, instead of investing to create higher productivity, they're doing, this thing, the stock buybacks, which gives you a little bit of sugar up front because you make your stock price go up. I mean, at the end, we need to make sure that I, as a governor, have more leverage to negotiate lower prices, and we need more competition in the pharmaceutical industry. As to why they don't do it in Washington, it seems as though they have a lot of influence on both parties. We don't want to kill them. Obviously, we want those drugs to be developed, but we need to bring about a system that's far more competitive than what we see.
Well, and you're talking about a competitive system, talking about having more free market forces in that system. And you said earlier we need to actually reward quality and not quantity. I've got a personal experience from a hospital in your state, the Cleveland Clinic. I had a terrible back injury, had back surgery, and when my back went out, I didn't walk for 4 or 5 months back in 2004. And I was in Cleveland when I had my problems. They took me to the Cleveland Clinic. They said, we've got the greatest spine surgeon in America here. You're going to love him. He comes in, he looks at me, he said, you're going to hate me, but you know what? You're going to do what dogs do when they get hurt. You're going to go in the corner and you're going to stay there. I'm not going to operate on you now because you've already had 1 operation and you'll have 4 more by the time, you're 60. So you're going to do nothing. And I sat there going, this is the best spine surgeon. But he knew the outcome would be better for me. I don't have those problems now, and he's exactly right. I've talked to other doctors since. If he had had the operation on me, I would have had 3 or 4 fusions. It would have gone badly. All other doctors I talked to at the time wanted me to have surgery because
Joe,
that's how they got paid. That's how they got their fees.
I was at the Cleveland Clinic yesterday, believe it or not. And there with people who came from overseas to take a look at what the clinic does. It's a remarkable place. It's patient-centered health care. Number 2, it's it's quality. It's not quantity. They're not, and interestingly enough, the doctors, I'm sure, are highly compensated, but they don't get paid for more procedures. The incentives are taking care of the patient, and the fact is, at the clinic, it's all about quality. It's not about quantity. That's why people all over the world go to the Cleveland Clinic. So this whole healthcare system needs to be reformed because as it costs more and more, you know what happens? People get rationed. We see rationing already, and those who are the weakest get the most amount of rations. That's not acceptable in our country. We can do all this,
Governor
folks.
John
If we
Kasich.
just knock off the ego and all the politics, we can fix these things. I know it. God bless.
I agree. I love his hope. John Kasich, thank you very much. And Joe, the president's latest tweet moments ago. The Republicans never discuss how good their health care bill is, and it will get even better at lunchtime. The Dems scream death as O-Care dies. Your thoughts, final thoughts.
I mean, how do you really improve upon what the president said?
He's going. Kasich was so hopeful.
Yeah. So the president's going to come to us and they're going to make memories that last till lunchtime because that's about the length of his attention span when it comes to pushing this Republican health care bill. Now, listen, the Republicans have a very difficult job ahead of them because they have a president that is not consistent. So it is going to be up to the Senate to figure out how to move forward. And then the House is going to have to figure out how to cobble together a coalition as well. So we'll see how that goes. It's a very difficult job for House legislators.
That does it for us this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.